Welcome back to HealthWise. For those of you that's just joining me, my guest today is Dr. Eric Chapman, an internal medicine doctor. Doc, I guess the big thing everybody is worried and concerned about is swine flu. Everybody is just, I mean, even though CDC has kind of downgraded a little bit, everybody wants to know what can they do? They don't want to catch the swine flu. So, I mean, what has your office seen a lot?
Well, we've seen a lot of, actually pretty significant amount of flu-like symptoms. And most of the people have not had very high temperatures, and that's basically one of the defining characteristics of influenza in general, is general illness versus, say, a cold, where you have high fever associated with sore throat, cough, muscle aches, chills, feeling tired, lethargic to some degree. There's that constellation of symptoms that makes you feel pretty ill when it comes on, and it comes on fairly suddenly when it does, actually. As far as confirmed cases, obviously most people have kind of been hearing in the news as far as the numbers, and to date, as far as I know, there's been one confirmed case here in Opelousas area. Most of the cases in Louisiana were actually in Lafayette, however, associated with a particular school which had some students or family members who had traveled to Mexico in a recent past. So there was that cluster there, and we think what they thought was that a lot of the other associated cases had direct and indirect contact with those cases. And so that's what's been going on with it. Of course, the spread is typical for influenza. I mean, influenza in general is something that's spread by contact and by cough and sneeze. So being in close contact with somebody who is infected and may not know that they're actually infected at the time, may not have started developing symptoms yet.
Well, that's leading into my next question. What can we do, to, I guess, inhibit the spread? Or, if someone that I know or don't know, like you said, has it, what can we do to keep from getting it?
Well, it's been recommendations that we should use all the time, and certainly more so in flu season or when there's anything else going around that's a contagious disease. One of the big things is hand washing, especially with soap and water. The alcohol type gels do a good job as well when you don't have soap and water, but soap and water is the first step, washing your hands. If someone around you is sick, or if you personally are sick, coughing, and that's one of the recommendations, instead of coughing into your hand or sneezing into your hand, actually doing it into your sleeve instead. Again, because you don't have the risk of transmission by touching surfaces, doorknobs, and other surfaces that your hands may not be completely clean after you've sneezed, or shaking hands, all those typical things that we do in a day.
And that what you just said is going against, traditionally, all your moms and everybody told you, cough in your hand, cough in your hand. And now it's interesting that now all the doctors and CDC and everybody, the general rule is now cough in the crook of your elbow or on your shoulder. Don't cough in your hand, because then you're going to spread it to someone. Yes. So everybody, the new thing is now, don't tell your kids to cough into your hand. Cough into either right there on your arm or your shoulder or something like that, because you don't want to spread it. Also, you mentioned the students that went to Mexico. That in itself, I mean, I think the CDC has changed that now. It used to be they were warning people don't go to Mexico. I think they've kind of lifted that. Am I correct? Yeah,
basically they're saying the way your risk versus your benefits. For somebody, if you can delay the travel, they're still talking about possibly delaying it. The big thing is that if you're somebody who's at high risk for developing complications of influenza, again, that's been the difference with this H1N1 flu virus, swine flu, is that we've seen people who don't fit that typical historic high-risk category. Very young kids, less than 5 years old, older people, more than 65 years old, or people with other chronic medical conditions. We've seen several young adults who became severely ill with it. I mean, the deaths here in the United States were actually young adults. One new one, an assistant principal in the New York area, from what I understand, was not a very old, was not over 65 was a young adult actually, and the one in Texas also was a young adult as well. Now again, always you have to look at these people may have had some other complicating, what we call comorbid conditions, other things that they were already ill with that gave them a high risk of becoming severely ill and subsequently dying from the virus. So when you look at travel, you know, if you're someone who has diabetes, if you have lung disease, if you have kidney disease, if you have any trouble with your immune system already, those things put you at high risk of getting complications from the flu virus, which is what most people get severely ill from or die from, not just the virus itself, but some other secondary complications such as pneumonia is one of the major ones. So with the travel, you know, if you're going to be going to Mexico or some other area that has had a high incidence of the disease, you'd want to potentially postpone it if possible, and if not, take those routine precautions as far as distancing yourself from people who appear ill, washing your hands frequently, avoiding avoiding contacting your face and mouth without having washed your hands, using surgical masks if you're going to be in close proximity to anybody that that you're not sure about, that has symptoms, whether it be family members, friends, anybody else for that matter.
Okay. Yeah, what you're saying, you know, I even had a little scare with that because I went to the International Festival, and it just so happens right after the International Festival, I came down with flu symptoms. It ended up being a sinus infection, but I had a little scare because, you know, I started seeing more and more of these schools were closing in Lafayette, and I kept thinking, okay, they're saying Mexico, but I was at the International Festival, you know, and I said, a lot of the people that you come in contact with, you know, you didn't know where they had gone on a plane or where they had been.
Exactly.
So that was something that really bothered me. And of course, I went and they did the influenza test, which was very uncomfortable. And but you know, they said, nope, you don't have it. And you know, but I had the fever, chills, and all that stuff. But it wasn't influenza. It was just like a sinus infection. Well, Doc, we'll come back after this brief, you know, message from our sponsors.
Okay.